The spring season is upon us, luring us out of our winter hibernation, and I've seen so many people walking and running, biking. The problem for many people, though, is that they were couch potatoes the past 4 or 5 months, and their joints are a bit rusty. Not to worry, though. The medical team of the Orthopedic Foot and Ankle Center can get you up and moving. Orthopedic surgeon Dr. Terry Philbin is here with some advice. Hi, doctor. It's a pleasure to have you here.
Thank you for having me here.
We were joking about the fact that you don't need to look at a calendar to know it's spring. You just need to go into your office and see how many people are in the waiting room, and then you know spring is here.
Exactly.
Because you have a lot of people coming in with injuries. Why does that happen?
I think a lot of it is, the winter months, it's very cold, we can't get outside. And I think, people are in a rush to look as good as they can with their bathing suit, now that the weather's finally getting better. And I think that's a lot of reason why that occurs.
What are some of the most common injuries that you see to the foot and ankle?
The most common things would be stress fractures.
In the foot and ankle?
Yes, more common in the foot than in the ankle itself. But stress fractures are very common this time of year. Plantar fasciitis, which is in the heel. Tendonitis, anywhere throughout the foot and ankle. And then also ankle sprains are very common this time of year.
What causes a stress fracture in the foot?
Well, the big thing is that what happens is that your muscles protect the bones. And when your muscles become fatigued, then what happens is the bones then take on all of the pressure. And so when that happens, the bones become fatigued. They can have anything from a stress reaction to a stress fracture, which means the bone will become inflamed, become weakened, painful, all the way up to the bone actually cracking as a result of this increased pressure.
Do you see equipment being having anything to do with injuries, like the proper shoes and things like that if you're going to run?
Exactly, yeah. The big thing is if you're not prepared to start running again and you go out in shoes that are old or not very supportive, even this time of year I see people that start wearing flip-flops for the first time. They'll go to an amusement park, they'll wear flip-flops the entire day, and believe it or not, that in of itself can cause a stress fracture.
That doesn't even sound like fun, actually.
No.
But maybe that's an age thing, and that's my next question. Do you see age as being a factor in a lot of these injuries?
Sure, I think years ago we didn't think that younger people could get stress fractures.
Yeah.
And the issue is that nowadays when you talk to kids, in teenage years or even younger, they're doing sports every day. Some people will go to one sport, then they'll leave and go to another sport. So they're not getting the rest that they're supposed to. I also think that if you see younger kids nowadays, they're always wearing flip-flops when it gets nice. And then the other end of the spectrum has to do with being older. And when we're older, then we start having issues with osteoporosis, and people like that are more prone to getting stress fractures.
You mentioned a couple things as far as why you see patients. First activity of the season, winter's over, but another one that you mentioned is vitamin D deficiency. And I don't know if we should be taking extra vitamin D, if just a multivitamin will take care of that, and the correlation between vitamin D and our feet and ankles.
Well, the verdict's not out exactly, but one thing we know for sure is that, since we don't have a lot of sunlight here during the winter months, and now we're getting more of that sunlight, the sunlight's very important in the production of vitamin D. So if we're not getting it during the winter months, I'm astounded how many people have vitamin D insufficiency.
Wow.
And that definitely has a lot to do with our overall bone health.
Mm-hmm. And the strain that'll put on it and all those things if you exercise. So you're saying a little extra vitamin D wouldn't hurt in people's diet, especially in this climate?
Absolutely not. Yeah, especially if you're a vegetarian, especially during the winter months here in Central Ohio. If you're not getting enough sun, which most of us are not, then that puts you at more risk.
Young or old, you're just going to start exercising. What should folks do to prevent these injuries to their
The big thing is just make sure as you increase what you're going to do it very slowly, very adaptively. If you're going to go from changing the surface that you do things on, for example, if you're indoors and you're on a treadmill, that's a lot different than going onto the pounding surface of a road and having different inclines. So that's a big thing. And then just make sure that you have the proper shoe wear, and make sure you stretch before and after, and just listen to your body. Don't be impatient or in a rush to get weight off or to look great, to get ready for a season that's just occurring now.
And then how will someone know when they should come to see someone like you, Dr. Philbin, that it's not just a sprain, and if they stay off their foot, it's going to get better? I
think the big things is, first of all, if you have an injury and you hear a pop, or you feel weakness, definitely be seen. The other things is that if you're having pain that's anywhere between a 4 to 5 out of 10, it's causing you to limp, you can't do work, you can't participate in sports, that's definitely when you need to be seen.
And when you hear a pop, that's just not a good thing anywhere on your body.
It's never a good thing.
We've had your phone number up there, doctor, so hopefully if people do have questions, there won't be some self-diagnosing that will come to see you for those answers. Nice
That'd be great. Thank you for having me.